Hi guys. Hey, how's it going? Hey, I'm going to do some Tox Environmental Emergencies. We did do a lecture on this a while back. This is just a refresher for you as you're studying for the final. I just picked the top 8. I picked 8 slides to review. Okay, here's our first one. We're going to talk about toxicology. So this is just some things to remember. If you can think of this quickly, if it's a powder, brush it off, like lye. Before you irrigate, brush it off. So powder, brush it off. If it's absorbed, like something on the skin, so gasoline or any kind of poison that's on the skin, we want to remove the clothing and wash it off with flushing it off with water. Inhaled, so like a chlorine gas or some kind of an inhaled gas, we want to put on some O2 so that we can flush it out of our respiratory system. Injected, especially if it's an opiate or poison, we're going to watch breathing if it's injected. And ingested, something you swallow, we're going to consider charcoal for ingested. All of these powder, absorbed, inhaled, injected, and ingested, we're going to call poison control. They're our best friend. And remember alcohol, check glucose, because alcohol can make a patient hypoglycemic. Okay, here's our friendly toxidrome chart, if you remember this from class. Anticholinergics, this is atropine, scopolamine, our antihistamines like hydroxyzine, diphenhydramine, which is Benadryl. So these would cause hypertension, a high heart rate, tachycardia, no real change in respiratory. They're hot, pupils are dilated, no bowel sounds, and sweaty. Or dry, not sweaty, dry, that's the cactus. So this is mad as a hatter because they're disoriented, dry as a bone because of the cactus, their skin is dry, red as a beet because they're hot, blind as a bat because their eyes are very dilated and they can't see well. Cholinergic, so this is organic phosphate poisoning. This can be from my example I gave you was a migrant worker who was exposed to pesticides in the field, but this is the sludge, salivation, lacrimation, where they're just crying, tears in their eyes, they have diarrhea, they're heavily urinating, pinpoint pupils, and wet skin. Okay, here's the ones we got to really focus on. Opioids. So we've got morphine, tramadol, heroin, meperidine, which is Demerol, fentanyl, oxycodone, OxyContin, hydrocodone. So we're going to see a slow down or decrease in our heart rate and our blood pressure. So bradycardia, hypotension. Respiratory. This is a respiratory depressant. So respiratory way down. Cool skin. Pupils are pinpoint, and the pupils are really is going to differentiate. When you're taking your test and you're looking at a scenario and it's saying the patient has blah, 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 what drug do you think they were exposed to? Really focus on the pupils. When it's pinpoint, we're looking at opioids, and when it's dilated, we're looking at a sympathomimetic. They have a decrease in their bowel sounds or no bowel sounds and dry skin. Sympathomimetic, this is our cocaine, amphetamine, methamphetamine, MDMA. So they're hypertensive, tachycardic, their respiratory rate is increased, so they're breathing faster, they're hot, pupils are dilated, they have hyperactive bowel sounds, which could also lead to diarrhea, and wet, sweaty skin. So again, our pupils in this one, the sympathomimetics are dilated. And the sedative hypnotics is our muscle relaxants, our Versed, benzodiazepines, anti-anxiolytics or anti-anxiety medications. So these really do mimic the opioid, the respiratory depressant, bradycardia, hypotension, dry skin, but there's no change in the pupils. So again, the big indicator for all 3 of our toxidromes that are generally tested. Opioids, sympathomimetic, and sedative hypnotics are our pupils. Okay, drugs of abuse. This is just highlighting these toxidromes again. Opioids, this is heroin, morphine, oxycodone, OxyContin. It's pinpoint pupils, respiratory depression, slow heart rate, hypotension. Everything is slowed down. And the big key is the pupils, pinpoint pupils. Stimulants like cocaine, MDMA, methamphetamine, these mimic the sympathetic nervous system, got dilated pupils, hot skin, tachycardia, hypertension. Again, the dilated pupils versus the pinpoint. Okay, so chemical exposure to the eyes. So what do? Flush them with copious amounts of water. You could use, it's good to use a bottle of sterile saline, just slowly dump that in. You could use some special devices to irrigate eyes. You could flush them with the nasal cannula prongs. Any way you need to hold the eyes open and flush them with as much water as possible. Remember always that we remove contact lenses for chemical burns. It's the one time we remove contact lenses. Okay, cold emergencies. I'm going to put myself on the top of this mountain here. Okay, so some basic principles. They're not dead until they're warm and dead. So if you come upon a person that appears to have no pulse and is apneic, you need to do resuscitation when they're cold exposed, because it's really, really hard to palpate a pulse, especially a peripheral pulse. When you're really cold, your pulses get very slow and very, very difficult to palpate. Always count for 30 seconds or 60 seconds on a hypothermic patient when you're checking a heart rate. But nobody is ever dead until they're warm and dead. So we fully resuscitate them until we've warmed them up. And then if they're still apneic and pulseless, then we would consider them dead. And but definitely when your temperature is less than 88, so more severe hypothermia, you need to handle patients very gently. No rough handling. Move them really gently, because rough handling can put their heart into VFib. Okay, so some treatment for hypothermia. Remove wet clothes, get them off. Move them to a warm environment, put your ambo heat on high, and move the patient into the ambulance. So those first two things are highest priority. Get their clothes off and get them to a warm environment. Passive rewarming by the blankets and the heat in the ambulance. And you could add some heating pads, warm bottles, things to the groin and the cervical area, the axillary area, places where blood is passing by. And how do we treat cold local injuries like frostbite, frost nip? No stimulants, so including coffee. Everybody wants to drink hot coffee when they're rescued, but we wouldn't give any stimulants because it can it can cause vasoconstriction and further the injury. No walking, and we really don't want them to move the frozen tissues. So we would splint to decrease the movement at all possible. Remove any jewelry or watches, because if there's some rewarming, we can have swelling, and also it can cause more. It can cause like further injury underneath the jewelry when it's frozen. And don't rub or break any blisters. We don't rub or massage any frozen tissues with frostbite or frost nip, because we'll just be doing damage to the tissues, and we don't break any blisters. Okay, so heat emergencies. This is heat cramps, heat exhaustion, heat stroke. So heat cramps, mostly in my experience, are with athletes or people on the field or kids playing outside in PE when it's really hot. So they can get cramps in their abdomen or in their calves. And really, we just want to have them rest and sit down and orally rehydrate, and they should be fine. Heat exhaustion, when you have hypertension, tachycardia, increased respiratory rate, some sweating to try to cool your body off. And then heat stroke is when there's no further sweating. It's much, much more serious injury. So what do? Remove them from the heat, put the AC on high in the ambo, but also prevent shivering. So if they are shivering, then we don't want this AC blowing on them because it's just going to increase the shivering. So remove them from heat, put them in a cold ambo, but if they are shivering, then we want to prevent that from happening and just allow for passive cooling. Remove the clothing, remove from heat, remove the clothing are the top two. Lay down, especially sitting down for heat cramps. This can cause hypoxia. Both cold and heat emergencies can cause hypoxia, so oxygen if they're hypoxic. Cool mist spray, again, spray them with some cool mist and a fan. That's helpful. Ice packs to the groin, the axilla or cervical area in the neck. Those are all areas where blood is passing through quickly, and so they can cool down from that. Orally hydrate if alert, like a Gatorade solution is best. And then always check glucose in these patients. Lightning, burns to the hands and the feet are what you look for entrance and exit of the electricity. And remember, it can cause abnormal heart rhythms. And I always associate it with golf because they're outside and there's a long metal rod. But it could be really just standing in a puddle or tennis, really, and riding a bicycle. Really, any outside activity could cause lightning. A lightning injury or a lightning strike, but I always do associate it with golfing because of the long metal rod. That's it. Thank you. Hope you have a good day.